Hi, my name is Sun Fu. I'm currently an informatics specialist at Mayo Clinic, and today my talk is natural language processing for the evaluation of methodological standards and best practices of EHR-based clinical research. After this talk, you should be able to understand what is EHR-based clinical research and what are the methodological standards and best practices associated with that, and how to use natural language processing to evaluate and assess the research reporting adherence. So the adoption of electronic health record offers innovative ways to conduct clinical research, and there is a prioritization of translational science and a need for evidence-based medicine. Clinical research is integrated into care practice. This aligns with the concept of learning health system. And EHR-based clinical research leverages the benefit of an inexpensive and enormous amount of information provided by EHRs, and their data will be converted to research-specific information through a process called chart review. And common way of doing that is this abstraction process involving with retrospective chart review. So chart review is a process of extracting and reviewing information from EHRs. And after that, we'll assemble a data set for various research needs. These needs including case ascertainment, status validation, information collection, and patient matching, and so on. And it is one of the most widely used methods for EHR-based clinical research. And despite its popularity and great potential, there are many methodological challenges, and particularly including lack of reproducibility, lack of research reporting standard, and adherence, and this will ultimately result in the translation cannot happen, cannot be made into broader scale of implementation. So important research findings will unable to be translated into effective care. So based on the review paper by Dr. Gilbert, so by looking at this table, except inclusion and exclusion criteria and variable definition, all other important methods for chart review are showing very low research reporting standard and adherence. And there are existing reporting guidelines such as record and StoreBit, but there are two main issues. The first issue is there is lack of methods to systematically evaluate how researchers adapt and use and these guidelines and how they are reporting. And the second issue is there is absence of methodological standard and best practice for EHR-based clinical research, saying the novel informatics methods and such as phenotype algorithms, advanced feasibility assessment tools such as I2B2 were not included in these reporting guidelines. So our objective is to develop NLP solutions using these clinical research reporting guidelines to evaluate and identify methodological standard and best practices. So our study was based on a research infrastructure of Rochester Epidemiology Project. We included study from 1995 to 2016, and after article selection, the final dataset was comprised of 1279 full-text articles. The guideline for annotation and NLP development combined record and StoreBit, along with two best practices framework. And so we've identified three main categories, including participants, variables, and data sources. So we want to understand how does each study formulate a cohort, and how were the participants selected, and how do the study team define and describe important study variables, and how do studies report their data collection method. So moving to the annotation, there are two main objectives. The first objective is to assess the reporting adherence based on existing standard. And second objective is to identify additional important activities that are not captured by the current standard. And the annotation process followed a standard process including guideline development, training, consensus, and annotation. To develop an NLP system, we use simple pattern matching and dictionary lookup method. And we also adopt two open source system and framework. One is Methodological IE and Stanford Core NLP. Since the task is requiring additional effort to capture pretty generic expressions, so we use a dependency parser from Stanford Core NLP to help with the pattern development. And we also follow a development process by split data into 50% training and 50% test, and using F measure for evaluation. After the system is developed and evaluated, we further apply the system to a larger rep cohort from 1995 to 2016, with the goal of identifying reporting adherence and reporting specificity. Reporting adherence in here is defined as giving an article whether a specific concept were mentioned or discussed. For example, whether the paper is discussing the data collection method, population selection method, and so on. Reporting specificity is measuring after data collection method was discussed, how specific this method were described. For example, some study may discuss data was collected from 2000 to 2005 without discussing who are the data abstractors, how the data was collected. So the reporting specificity is to measure how detailed each steps were described. And then we further did a trend analysis to study the usage of methods throughout the years. And lastly, we did authorship and affiliation analysis by studying how authors' training background will have different effects of how they report the best practices. So this is the first result slide, and this slide is showing the performance of NLP system, and to ensure later on after we apply the NLP, the results needs to be valid and reliable. And in total, there are 9 tasks, and 5 out of 9 achieved high performance, and 3 out of 9 achieved moderate performance. This was due to high language variability and limited gold standard. This slide shows the adherence analysis for study population selection, and indicated there is a high reporting adherence and high reporting specificity. And chart review, database query, and standard terminology are 3 most used methods. For measurement of variables, we find pretty low reporting adherence and high reporting specificity, meaning when the clinical intervention or criteria was mentioned, in general it's pretty specific, but only 35% of studies did report measurement and assessment of variables. Furthermore, we find moderate reporting adherence on the methods of data collection and low reporting adherence on data quality assessment. And further, we find low reporting specificity, meaning when study discuss the data collection methods, it's usually pretty general, and there may be indicating a potential gap between the study team and data retrieval team. The author analysis was conducted to compare reporting adherence stratified by author's training background. We found that paper with first author of epidemiology background were more likely to report good practice. The slides also indicate a significant upward trend of using informatics methods since 2009, since 1998. Lastly, we also identified this list of computer-based case ascertainment algorithms reported by a number of articles, and these are additional value added and was suggested to be added to the future guideline. So in conclusion, we discuss an upward trend of reporting research methodologies, good practices, and utilization of informatics-related methods. However, there's still a consistent underreported patterns of methodological standard. And we also discovered a high variation regarding clinical research reporting. And in conclusion, we recommend to further research and develop process frameworks, ontology models, and reporting guidelines for the given context. For the future study, we would like to apply the system and framework to broader scale, including clinical trial protocols and PubMed articles. For PubMed articles, it allows us to study institutional differences regarding how clinical research was reported. I would like to thank Center for Clinical Translational Science and Mayo Clinic, the co-authors, and Mayo Clinic Advanced Team and Mayo Clinic Digital of Health Sciences. If you have any questions, feel free to email me, and thank you very much for your attention.